everyone. Can I just confirm that you guys are able to hear us? Okay. بسم الله الرحمن الرحيم الحمد لله رب العالمين وأشرف الأنبياء والمرسلين نبينا محمد وعلى آله وصحبه أجمعين رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقه قولي. Once again, a formal introduction and a welcome to all of you. Assalamu alaikum wa rahmatullahi wa barakatuh. We welcome all of our students to the special one-off online session on managing your health during Ramadan, hosted by Ulum Academy UK. As we all know, Ramadan is a sacred month of worship, reflection, and spiritual growth. Alongside our ibadah, it's equally important to approach fasting with awareness and responsibility towards our physical well-being. Many people often ask and have questions regarding diet, daily routine, long-term health conditions like blood pressure, diabetes, and the safe use of medications whilst fasting. So this session, alhamdulillah, aims to provide clear, practical, and evidence-based guidance to help you prepare for Ramadan with confidence, balance, and informed decision-making so that you can focus on your worship whilst maintaining your good health. Alhamdulillah, today we have alongside us Dr. Samira Osman, who is a qualified pharmacist and a member of the British Islamic Medical Association. She has extensive experience supporting patients with medication management and long-term health conditions, with a particular interest in helping Muslim communities navigate health decisions during Ramadan. She's very passionate about providing clear, practical guidance, harmonizing between faith and medicine. So without any further delay, I'll hand it over to Dr. Samira to present the seminar, inshallah.
Assalamu alaikum. I hope everybody is well today. Jazakallah khair for having me here today. Before we start, my brother Naveed was to be here, but Allah khair, he's had some sort of calamity. Please, if everybody can make dua for him, may Allah ease whatever problems have come his way. Inshallah, let's get started. So as Brother Kaim has said, I'll be speaking to you today about how you can manage your health during Ramadan. Before I start, I just want to give a disclaimer that this information that we will be sharing today is for general information for healthy adults. It's not personal medical advice. Therefore, I would advise that you take caution, especially if you have some medical conditions. It's important that you speak to your clinician for an individualized plan. And all opinions are those of me and not of BIMA. We've independently compiled this information free from industry, free from government influence, and it is primarily for public benefit. If you do have any questions or any concerns about anything that I share with you today, please contact this email address that I have shared with you here. So let me just tell you a little bit about BIMA. So we are a voluntary organization of around 10,000 plus Muslim healthcare professionals. We have a wide variety of professions. There's doctors, pharmacists, dietitians, you name it, any healthcare kind of profession is involved within the British Islamic Medical Association, and we have a strong presence across the UK. We bring together strong Islamic views and medical views together. And we do a lot of work within the community. We do a lot of work with healthcare professionals. And what we really want is to see a healthier world through unity and empowerment of our Muslim health professionals. Our mission is that we are a professional home that connects, benefits, and represents our members, enabling positive transformations in the communities that we serve. We're governed by our faith inspired values of collaboration, excellence, compassion, and integrity. So for I think a lot of you already know what Ramadan is. So it's the fourth pillar of Islam, ninth month of the Islamic calendar. It's when the Quran was revealed, and we believe that it's a month full of blessings. It's obligatory on all Muslims to fast. However, I'm sure you know this better than I do. But we have been blessed with exemptions. So people who are acutely unwell, have long-term conditions, something that can be worsened by fasting, we're exempt from having to fast, as are those who are frail, elderly, women who are pregnant or breastfeeding or menstruating. But I will go on into more detail about women who are pregnant and breastfeeding towards the end of the webinar, and equally travelers. So Alhamdulillah, Allah subhanahu wa ta'ala has blessed us with the exemptions should we need to actually take part in an exemption if we fulfill any of these criteria. That is, if we are doing this to strive towards Allah subhanahu wa ta'ala, it is a form of worship for us during the month of Ramadan. So I'm going to start by talking about how can we plan. So Ramadan is just by it's on our doorstep now. It's almost knocking on our doors to say that, I'm here. And what are we doing to actually prepare for Ramadan, and how can we prepare for Ramadan? So I think one of the things that we actually forget about, especially, today, Alhamdulillah, I can see that we are a room full of women, is we forget about ourselves. We forget about how do we look after ourselves during Ramadan. And looking after our bodies is part of our ibadah. So the first thing that I want to talk to you about today is about exercise and how do we actually incorporate exercise in Ramadan, okay? So what our NHS guidelines suggest is that we should be doing strengthening activities which work all our major muscle groups at least twice a week. Okay, so our major muscle groups are our legs, hips, back, abdomen, chest, shoulders, arms, and out of this, we should be doing at least 150 minutes of moderate or 75 minutes of vigorous intensity activity a week. We're advised to spread this exercise evenly over 4 to 5 days a week, and we should actually be reducing our time sitting or lying and break up periods where we're not doing any activity with activity. So 10,000 steps a day is what's recommended. And I know all my sisters who are watching now are going to be thinking, how do I get this in the best of days, never mind in Ramadan? Okay. So the kind of things that I actually recommend to my patients when they come to me is, I know myself. It's quite difficult for us to get this time where we are concentrating on ourselves, where we're concentrating on doing some exercise or some physical activity. So how can we think outside the box? What can we do that will actually help us to get close to this 10,000 steps a day? So one of the things that I recommend is maybe when we're going shopping, so we're in the Tesco car park, or we're in the supermarket car park. How do I ensure that I can get extra steps in? Let's park the car further away from where we would normally park. Okay. So if I park maybe 2 or 3 streets away, it means that I'm then forced to walk extra. Okay. I have to walk all the way to the shop. I then have to go inside, get my shopping, and equally, I then have to carry my bags to the car. Okay. So what have I done? I've increased the amount of steps that I've taken, and equally, I've now actually had some kind of strength activity in that because I've carried my shopping further away to the car because I've parked it further away. So it's these type of things that I want you to start thinking about now, of how can you incorporate these kind of activities while you are fasting. And it might even help you, before and after fasting as well. Another tip I can kind of give is, sometimes if we're living in a house where we have an upstairs and a downstairs, I like to keep my shopping upstairs. So what happens then is I have to climb up the stairs, get what I need, climb back down the stairs, go into my kitchen, do what I need to, and then I've forgotten, oh, actually, I forgot to bring something else, and then I have to go up the stairs again. So it's further away. That's actually adding a bit more of an activity onto what my daily routine is. Okay. So I totally acknowledge that these are the NHS guidelines during Ramadan. As busy working women who have to look after our families, we have to look after everybody else. This might not be possible. But now what I want you to think about is actually, how can I make it possible, or how can I make it close to possible? How can I get some sort of strength activity as well as increase the amount of steps that I'm taking? If you are able to actually go out, the best time for you to exercise in Ramadan is before iftar. Okay. Before iftar, we recommend gentle exercises like walking or stretching. After iftar, so after you've had your evening meal, moderate workouts are recommended. So you can do your cardio or your strength training. Now might be the time for you to go to the gym if you are able to. And post Tarawih is probably the best time to do strength training or longer sessions when you're fully replenished, because at that point it's okay if you are partaking in something that is more strenuous. Hydration wise, for your physical activity, aim for 6 to 8 glasses of water between iftar and suhoor. You need to make sure that you are, sipping water. I don't want you to drink all 6, 8 glasses at one time. You want to do this slowly throughout that time that you are awake between iftar and suhoor. Avoid caffeinated drinks, so coffee, tea, fizzy drinks, because this can dehydrate you. And my advice to you is to start thinking about that from now. So start thinking about today. How can you start reducing the amount of caffeinated drinks that you're having now? So when it does get to Ramadan and you're fasting, you don't get the caffeine headaches, or you don't feel like it's dehydrating you, because you're starting to get used to it. So now is the time to start thinking about this. At the times when you're eating, focus on complex carbs, focus on healthy fats and proteins. And I'll go into this in a little bit more detail when I talk about food. Okay. My key tip about exercise and physical activity is avoid overexertion and listen to your body and adjust your intensity. Equally, I know we're all busy. I know that we have our routines which we can't cope with as it is. And when the Ramadan, routines come in and everything is just out of sync. But think about how can you incorporate these activities into your life where it's not actually that much of a strenuous activity for you, but equally you are looking after your body as well. So moving on now, let's talk about food. Okay, so what kind of food should we be thinking about um, during Ramadan? So, 8 hours after we've last eaten our body enters into something that we call the fasting state, which means that all the nutrients have been absorbed from the gut, and this is when the body has also used up all of its supply of glucose. Okay, so we can actually use that to our advantage, so that at the time of suhoor, what we want to do is we want to make sure that we're adding lots of protein. Okay, what that will mean is that you're going to feel fuller for longer during your fast. So the kind of things that I want you to think about in your suhoor meals are eggs, Greek yogurt, beans, lentils, fish, chicken. Have a wholesome protein. Equally, look at whole grain carbs, something that's high in fiber, okay, so that your energy will be absorbed slower, making you feel fuller for longer. So whole grain bread, whole grain bagels, whole grain naan, oatmeal, barley. Think about healthy fats, because your healthy fats will also help you feel full, and it'll make you feel satisfied for longer as well. So you can think about maybe avocados; they taste so good as well. Nut butters, nuts, seeds, hemp seeds. So these are just healthy fats that you want to add into your suhoor meals. And then fruits and veg, these are high in fiber. Some fruits and veggies also have a high water content, which can help your hydration while you're fasting. So, think about watermelons, strawberries, cucumbers, lettuce. Make sure that your suhoor is actually a wholesome meal, okay? Because you most likely will only be eating twice in Ramadan. So, make sure that your suhoor is very wholesome. And equally, I'm talking about iftar. Make sure your iftar is equally as wholesome as well. The sunnah is to start off breaking our fast with dates. And what I and I think majority of us will have this in our routine anyway. We'll open our fast with some dates. We'll have a glass of water, maybe have a bit of fruit, pray our Maghrib Salah. And by the time that you've actually just finished praying your Salah, you realize that you're not actually as hungry as you thought you possibly would be. So that point, it helps you to start eating at a slower pace, so you enjoy your food without overeating. And for those of us who are from South Asian backgrounds, this one will probably be a bit hard for us. But I think it's about time that we start thinking about putting away our deep fat fryer, put away that karai, and actually let's start using our ovens more. Let's bake our food. Equally, air fryer food is amazing. You know, you can actually get amazing recipes in an air fryer. It's all less fat, more healthier. And kind of think about what you're consuming. So, you know, consuming fatty and sugary foods. It actually leaves us feeling sluggish. It feels, you know, you feel tired after you've had a big, huge meal, you know, when you've had all them samosas and them kebabs. I know it tastes good, and I know it's what we're used to, because that's probably what we've all grown up with. But I think it's time now for us to think about how do we make these changes and how do we actually get healthier for ourselves and for our families. Um, our iftars are quite carb heavy, they lack protein. But like I said to you about the suhoor, let's think about adding proteins in every iftar as well. Okay, this will make sure that your body has all the required nutrients it needs. So, you know, fish, chicken, steaks. But then equally, there is plant-based proteins like lentils and beans as well. So, you know, start thinking about your meals, start planning your meals. And I'll give you some tips of some recipes, etc., towards the end of the webinar as well. So I've already kind of touched on this, but you know, we need to start planning. Okay. So you don't plan to fail, but if you fail, you plan. You need to start planning. So you know, we need to use Shaban proactively. I think we're a bit late into this now, but maybe trial fast. There's still a bit of time. Find out what food and drink works for you, works for your families. Okay. Think about your health. Start thinking about how previous Ramadans, what experiences you had. Are there any kind of medical conditions? Are there any changes within your life? Anything that you need to start thinking about? Start planning your caring duties, start planning your work, your studies, your family obligations, and make sure that you actually have time for yourself within this as well. Okay. So already I've started to think about is, am I going to be able to I work full time. I work at the University of Birmingham. I teach. So we have a timetable that we have to follow. And if I'm timetable to teach at the time when it's you know, Maghrib, I'm gonna have to break my fast there, which equally means what's gonna happen to my family. Okay. Does that mean that I have to plan my meals beforehand? So I've already started to think about this, and these are the things as kind of, you know, women and even men as family, you know, orientated individuals, we need to think about these. And these things are for us to actually start planning from now. What about work, you know, towards the, you know, last 10 days of Ramadan? You know, maybe I want to think about taking some annual leave, just so that I have some more time for myself, I have some more time for my ibadah. Community work, this is the time when we're thinking of, you know, giving back to the community. What do we want to do? How are we going to do that? How am I going to plan that into my routines? Okay. So planning is key. There's always going to be obstacles, there's always going to be commitments in our lives, but if we plan and we plan well, you know, inshallah, Allah subhanahu wa ta'ala will help us, you know, through this time. And Ramadan is full of, you know, blessings and barakah. But think about, you know, in the last days, about your sleep, think about your family obligations, think about how you're going to stay hydrated. How are you going to fulfill all your commitments as well as feel that you have fulfilled your duty of Ramadan as well? Okay. So I know implementing change is not easy. Okay. But small changes can make a big difference. Okay. Ramadan is an amazing time to perfect new spiritual habits. We can then take these forward in our day-to-day lives. We can also use this opportunity to implement physical health changes that will benefit us in the years to come. So we know from research that small incremental changes will be more likely easier that we stick to them and achieve in the long term rather than radical big steps. Okay. And this is obviously also actually in keeping with our sunnah, because our Prophet ﷺ said, take up good deeds only as much as you are able. For the best deeds are those done regularly, even if they are few. The opposite is also useful to think about. If in Ramadan we accumulate poor physical health habits, will this then actually extend on to our daily lives afterwards? Okay. So, the cycle of change actually recommends that if you make a change for 30 days, you're more likely to actually stick to that. So, what better time for us to start making these changes than Ramadan? Okay. Decide what your short-term goals are for Ramadan. Decide what your long-term goals are. And inshallah, if you start practicing these changes from now before Ramadan, it will be so much easier when we are in that time. So sleep, I think for me, and for many other Muslims out there, Ramadan isn't about, being hungry, isn't about us abstaining from the food and marital relationships. The hardest thing, I think, for all of us is the lack of routine and the lack of sleep. Okay. So obviously we're waking up for suhoor, we're praying throughout the night, we're eating at irregular times. There's disruptions to our normal rest cycles. Okay. Remember that Taraweeh in the masjid is a sunnah. However, Isha is fard, okay? But try not to neglect it and be mindful if your health or your work performance is suffering, that's then a decision that you need to make, okay? If you undertake irregular shift work or are in safety critical jobs, having enough sleep is more important. So speak to your line managers if you're concerned and be open, okay? Um, for people that are working, especially within the UK, religion is a legally protected characteristic, and reasonable adjustments can be made, but only if you've given your employer enough notice. So, if anybody does need support with that, BIMA have occupational health guidance, which you can signpost your employer towards, only if that is needed. And poor sleep is implicated in poor Ramadan related performance. So, and that's more than actually a lack of food or water. So be aware that Ramadan may affect your duties, but it is your responsibility to actually make these changes from now, and make people aware of who need that. Okay. So stay on a consistent sleep wake schedule, try and making sure that you are having some sort of consistency within your routine. Avoid eating or drinking in your bed, or working while you're in your bed, because that actually affects your sleep as well. Okay, sleep in quiet, dark environments. You want to engage in some sort of relaxing activity before bed. Avoid scrolling through social media or using your phones before bedtime, because equally that can affect your sleep as well. And caffeine, you don't want to be taking caffeine just before sleep. That will actually affect the quality of your sleep. Sometimes during Ramadan, what I do recommend is maybe short bursts of 20 to 30-minute naps. Then power naps can actually be quite useful, just to kind of recharge your batteries. But try and within your routine, make sure that you're thinking about having that protected sleep time, because rest is very, very important. So just certain possible health complications of fasting. So this is only top line. We're not talking about long-term medical conditions at the moment. But what are the common kind of things that you might encounter during Ramadan? The main common one is heartburn, and unfortunately, the main culprit for this is overeating. Types of, and mostly that could be, spicy food, fried food. So the advice for this is moderate your have moderate portion sizes, reduce the amount of oily, fried, spicy food that you have. Um, we've already touched on using, your oven more, bake more, use your air fryers. And if you do still suffer from heartburn, you can actually visit your local pharmacy. And there are lots of over-the-counter medications that can help, such as Gaviscon, and other things as well. Sometimes, milk can also help with heartburn. A second most common complication is headaches. This can either be due to dehydration, it could be because of caffeine withdrawal, or it could be because of sleep deprivation. So preparation and planning and routine can help avoid all of these. Okay. Dehydration can actually be avoided with adequate preparation. Make sure that you are drinking between 6 to 8 glasses of water, so around 1.5 to 2 liters of water from suhoor, from iftar to suhoor. Make sure you're sipping on this water. Make sure you're drinking it throughout that time, and not just having, a lot of water all at one time, because you're just simply going to urinate it out if you do it like that. Constipation can also occur due to a lack of fluid, a lack of moving around. So try and keep active, have a high fiber diet, and if in case it does get bad, you can again visit your local pharmacy, and over-the-counter laxatives can be used as needed. So as always, if you have a long-term condition, you need to be more careful in Ramadan. I advise you to speak to your healthcare professionals, speak to whoever manages your condition, and ask them if it's possible for you to fast. Okay. In most mild diseases that are well controlled, it is safe for you to fast, and you may just need some adjustments to your medications, possibly some blood tests before and during fasting. And you may need to have a specific diet or lifestyle depending on what the condition is. Also, you need to kind of know what signs and symptoms to watch out for in case of an emergency. So what kind of signs and symptoms would you have, for example, if you had low blood sugars, if you had high blood pressure, low blood pressure, if you were dehydrated. So, how much fluid do you need? Because low fluid levels can cause blood pressure to drop, and dizziness or falls, especially in the elderly. So this can be, towards the end of the fast, but also taking some kind of medication can also affect this as well. Um, and I do always actually recommend that you speak to a scholar as needed as well, because we can give you our medical opinion. Um, the scholars can then give you the Islamic opinion, but at the end of the day, that decision is yours. Okay. Um, we can support you as healthcare professionals, as can our scholars give the advice, but then that decision to fast lies with you as the individual. We've been given exemptions, as kind of in the Quran in Surah number 2. If somebody has an acute or a long-term condition in which it would be harmful for them to fast, they are exempt from fasting. Okay, if fasting becomes difficult due to the illness, if the illness is going to be worsened due to fasting, if somebody's health is going to deteriorate, or if they need medications during the day, which can't be kind of adjusted, Allah subhanahu wa ta'ala has blessed us with this exemption. So make use of it should you need to. So people with long-term medical conditions can fast. Okay. It's just important that you do contact and speak to your medical doctor first. Actually think about what has happened in the past. Have you tried trial fasting? Are there any medication adjustments that you need to have? Do we maybe need to change the type of medication that you're having? So it's really important that you go and speak to your healthcare professionals. I can't stress this enough. I know, a lot of my patients have also said to me that we were worried about going to speak to our doctor, or we were worried about going to speak, to our pharmacist in case they tell us not to fast. But at the British Islamic Medical Association, we've been doing a lot of work with other healthcare professionals to actually support them, to support you as patients, to give you the right advice, and to support you to make that decision of whether you should be fasting during Ramadan, or if there's any other things that we can do to support you with. So the main pieces of advice that I would be giving my patients is to make sure that they are staying hydrated. So it's important that they are drinking plenty of water, at the times of when they're not fasting, because dehydration can worsen conditions such as kidney disease, it can worsen diabetes, it can worsen heart disease. I want my patients to be having healthy meals. I've already spoken to you about eating balanced meals, making sure that they're having lots of proteins, make sure that they're not having a lot of spicy, salty, fried foods. Because all of these can actually cause you discomfort. And equally alongside discomfort, it can raise your blood pressure, it can raise your blood sugar levels as well. I want you to avoid overeating because eating large amounts of food can actually strain on your digestive system. So eat moderate portions, eat slowly, because when you eat slowly, that actually helps you to avoid indigestion, you avoid heartburn, you avoid bloating. Patients who are taking medications, I want you to make sure that you are following your doctor's advice about the timing of the medications. Alhamdulillah, we're in a position now where our fasts are not as long as they used to be. 5, 6 years ago, we were fasting, 18, 19 hours during the day. But Alhamdulillah, I was actually speaking to some colleagues, and we believe that we're gonna have more Muslims fasting this year with long-term conditions who maybe wouldn't have fasted, for at least about 10, maybe even 15 years because of their medical conditions. But because the fasts are now shorter this year, Alhamdulillah, they might actually be managing to fast for a whole Ramadan possibly. So that as for us as healthcare professionals is an opportunity to be able to support our fellow Muslims who haven't been able to fast, but inshallah, they should be able to this year. So my main advice is never skip your medication, okay? Um, speak to your healthcare professionals, see if there's anything that we can do and we can advise you to do differently during Ramadan to support you to take your medications. Um, your doctor or your pharmacist may ask you to check your blood sugars more regularly. They may ask you to check your blood pressure more regularly. Um, and if you do experience any symptoms such as dizziness, excessive thirst, or confusion, we advise you to break your fast. I'll go into this in a little bit more detail in a little while. But at the British Islamic Medical Association, we have actually compiled what we call the Ramadan Compendium. So this is to be used by healthcare professionals to support our patients to make that decision of whether they are low risk of fasting, where they might be high risk, or they might be very high risk. So, experts from all over the world have actually worked alongside us to bring together evidence-based guidance. So, this is guidance for healthcare professionals to use. Um, and it is freely available on the BIMA website. Like I said, we work with healthcare professionals, so Alhamdulillah, the advice for them is out there to be able to support you. So go and have these conversations with your doctors, with your pharmacists. So just kind of talking about what kind of chronic conditions that I'm kind of might be concerned about. So if we have patients who are asthmatic, I would advise my patients to use their inhalers at iftar time and at suhoor time. I also advise them to avoid triggers. So, certain people might be triggered by dust or smoke. And I always advise my patients to keep your inhaler with you because in case you have an emergency and you need to use your inhaler, you should use it, okay? Because obviously your health comes first. And we shouldn't burden our bodies more than what they can bear. So, if it is an emergency, you're able to use it. Okay. Patients who have chronic kidney disease, so this is kind of kidney problems. I advise them to drink plenty of fluids during the non-fasting hours because that prevents a strain on the kidneys. Make sure that the doctor is aware that they are fasting because the doctor may want to monitor kidney function before and after after Ramadan. So you might need to have extra blood tests. So it is important that you speak to your doctor. Heart disease, so be cautious with medications such as diuretics. So that's your water tablets, because these can cause dehydration. So I advise my patients to take these in the evening with the iftar meal. Also advise them to monitor their blood pressure and ensure that they don't have swelling or fluid retention in their body. So if they are starting to swell up, especially around the ankles, it's important that you consult your healthcare professionals. Patients with diabetes, advise them to keep a blood glucose monitor with them. So if they do feel that their blood sugars have gone too low, they can check their blood sugars, they can break their fast, and they can seek medical attention as well. Okay. Um, if you are taking medications, speak to your healthcare professionals because we might need to change what type of medication that you're taking so you can actually fast. Okay. I'm just going to go slightly into what what we use to make that decision of whether a certain formulation, certain medication is actually allowed to be taken while you're fasting and it doesn't actually affect your fast. So this is criteria which our scholars have given to us. However, please do remember, which is one of the things that I said at the start, different scholars have different views. Okay, so different schools of thoughts may or may not agree with what I'm going to say. Um, so please check with your own school of thought before you take what I'm saying. Um, so this is the criteria that we would use to actually determine whether a formulation can be used while somebody's fasting. So it has to be a visible substance. And if that substance reaches the digestive system um, through an entry point, which is connected to the digestive system, so that's either through the mouth, the nose, the anus, or through a deep abdominal injury, and that substance then stays there and if all five of these criteria are met, then the fast has been invalidated. So, bearing that in mind, I can show you this table, which shows me what I can and cannot prescribe for my patients while they're fasting. So, for example, creams, lotions, deodorants are absolutely fine because they're not entering into the body, as are patches. So, sometimes I might need to change my patient's medication to a patch. Equally, sometimes what I can do is change their medication to something that is long acting. So they only need to take that once a day. It might be a modified release oral preparation that they can have. So as you can see on here, inhalers and nebulizers, certain schools of thought believe that they can be used while a patient is fasting, and others believe that you can't. Okay. We actually all agree that eardrops and eye drops can be used during fasting. However, if the eardrum is perforated, so if there's a hole inside the eardrum, then what happens is it becomes an invalidating entry point. So therefore, the fast would actually break if an eardrop has been used while the eardrum is perforated. Okay. Vaginal pessaries are actually allowed to be used during fasting. However, anal suppositories are not. Okay. So what I've done is I've just picked a few here from that table. So I want you to just take a few seconds and I want you to think about whether we can or cannot use these during fasting. So I'm just going to give you a couple of seconds just to think about this, and then I'll give you the answers. Okay, so eye drops and eardrops are not considered to break the fast if, like I've already said, the tympanic membrane hasn't been perforated. Vaccinations, patches, and blood tests do not break the fast. Inhalers, nasal sprays, and injections actually depend on the substance and the format, and they will require more specific review and guidance from your local scholar to give you more information about that. So, just kind of moving on to urgent vaccinations. If anything is urgent, if anything is an emergency, um, you can actually break your fast. Okay. So it's really important that you do remember that and don't burden your body more than what you need to. So good health is crucial to worship effectively during Ramadan. Vaccinations can help protect against illnesses like flu and COVID. And blood tests actually allow us to manage chronic conditions. So during Ramadan, the immune system may weaken slightly due to the changes in eating and hydration patterns. And vaccinations protect against seasonal illnesses that could make fasting more challenging. So community members who are elderly, diabetic, or have weakened immunity, I advise that they go and get vaccinated for flu, for COVID, and any other vaccinations because it's our collective responsibility to protect ourselves and each other. Okay. Speak to your doctors about early tests because that can help you to get personalized advice to make sure that Ramadan is safe and a healthy experience for you. Um, I think I also do advise patients to make sure that they check iron levels because anemia, especially within women, can be quite apparent, and lots of women do suffer from this. So if you are feeling more fatigued, you're feeling more tired, actually get your iron levels checked. And blood tests and vaccinations actually do not break the fast. So, I'm just going to move on now. Like I said at the start, I was going to speak about pregnancy and fasting. Okay, so the majority opinion is that pregnant and breastfeeding women are obliged to attempt to fast unless they fear harm for themselves or their child. Okay, so this concession is based upon the hadith, where it was reported that the Messenger of Allah subhanahu wa ta'ala, may, peace and blessings be upon him, sallallahu alaihi wasallam, said, Allah has lifted half of the prayers and fasting from the traveler and fasting from those who are pregnant and nursing. Okay, so whether you're able to fast or not, pregnancy is a risk and a blessing from Allah. So embrace the changes with kindness for yourself, gratitude and patience, and make the intention that looking after yourself and your little ones is actually an act of worship. Okay, so whether you can fast or you can't fast, you need to make sure that you're not burdening your body more than what is necessary. Okay, and you and your child actually come first. Okay, so with that in mind, the main thing that I can say is always, always, always discuss with your doctor and your midwife about fasting during pregnancy, just to ensure that it's actually safe for you and your baby, and so that your healthcare professionals are aware in case they do need to kind of give you more advice or guide you. Okay. When you are pregnant, your body is under more physical stress. So therefore, avoid strenuous activity. Try to incorporate light exercise and make sure that you do prioritize sleep and rest. You might be more prone to morning sickness, especially in the first trimester. So ensure that you're drinking enough water and staying hydrated. Remember to take your medications. It is actually advised to take folic acid, vitamin D, iron supplements. You might even have anti-sickness tablets that you need to take. And it's recommended that folic acid is taken from when you are trying to conceive up to 12 weeks of pregnancy. And it's important that you do carry on taking this through Ramadan as well. Make sure that you're eating balanced meals, fiber-rich, whole grain foods, vegetables, nuts, proteins. It's all very important. And like I've said before, avoid high fat, deep fried, and excessively sugary foods. Okay. If you have gestational diabetes, discuss with your midwives and doctors about how to best manage this during fasting. Have them conversations with your healthcare professionals. I can't stress that enough. So, the kind of warning signs that I would like my pregnant women to know about is if you have dizziness, dark urine, or a rapid heartbeat, I'm going to think it might be dehydration. Okay. Um, Signs of low blood sugars are shaking, sweating, blurred vision, weakness. Okay. If you get severe abdominal or back pain, if your baby's not moving as much as normal, if you have any vaginal bleeding or fluid discharge, if you're unable to keep any fluids down, or if you're feeling that you have a fever, breathlessness, or worsening symptoms, if any of these that I have just said to you occur, um, it's recommended that you break your fast and contact your doctor or midwife immediately. This is very important. The majority of women, while they're pregnant, can fast, but in case you get any of these signs, the advice is that you do need to contact your doctor or your midwife immediately. So the postnatal phase, this is a key window for ladies who have just um, had a baby. It's a key window for physical, emotional, and spiritual recovery. Um, Caring for your body is ibadah, because your body has a right over you. Okay, um, women um, actually have a higher risk of cardiovascular disease, of heart disease. Okay, so it's recommended within 6 to 12 weeks of having a baby that you have a blood pressure check, a glucose check, and a weight check, because caring for your body is actually fulfilling that amana. Okay, um, emotional well-being is very important. 1 in 8 women have postnatal depression, so it's really important that you get early help. Get early help from your GP, from your support networks, from your peers. There's a lot of support that's out there. Make use of your friends, of your family. Okay. Islam encourages healing, so shifa. So seeking help is not a weakness. Seeking help is actually a sign of strength. Okay. Breastfeeding and nourishment actually benefits both the mother and the baby. The World Health Organization actually says that breastfeeding reduces cardiovascular disease and reduces the risk of cancer as well. Okay. Mothers normally breastfeed for 2 years. However, it's really important that you're staying hydrated, you have balanced meals, and resting is also part of worship, especially if you're doing it for the sake of Allah subhanahu wa ta'ala. Um, Post-birth recovery, normally recommended that you screen and so have a blood test and treat anemia as early as possible. The 40-day nifas period actually aligns with the World Health Organization recommendation of a 6-week recovery. So rest and nourishment is very important. So we're integrating our body, mind, and care for soul as well. So make sure you're putting yourself and your body first. Okay. So key points that I want you to take away from this is I want you to start planning your Ramadan as early as you possibly can. Make sure that you're balancing your nutrition, your sleep, and your health, and empower yourself with knowledge and support. Now, to support you with this, the British Islamic Medical Association have actually developed something called the Ramadan Reset Project. So it is a project where it helps you to set goals, it helps you to plan your Ramadan, and it helps you with time management so you can balance your life and your ibadah. Following this, if you scan this QR code, it will actually take you to a page to help you to actually sign up for this project. And what you get is a Ramadan Reset Journal. In this journal, it was designed by students and it was designed for students. However, it's not just for students because you can actually use this um, from any walk of life. And we have a calendar, we have a weekly habit tracker, we have weekly challenges. There's a section on there for adhkar. There's a section on how to support you for healthy eating, exercise. It gives you practical health tips. There's a section about tarbiyah. And the best thing about it is we have recipes, okay? They are all recipes that have been developed by nutritionists. They are balanced meals, and they are recipes that you can make in quite a short time, and they are delicious, okay? Um, we have the journal, which gives you smart targets. So you can actually write your own targets in this journal. It's free of charge. You can sign up using this QR link. You'll then be able to download the journal. and you can participate in the weekly challenges to set yourself realistic goals. Jazakallah khair. That brings me to the end of the presentation, and I will. There's a feedback form here. You can scan this QR code. When you fill it in, the feedback form, you will then actually be able to download certificates of attendance to this webinar. So, thank you very much, Brother Gaim. I head back to you, inshallah.
Barakallah Fiki for that amazing presentation. We'll now open it up for all of our students. If anyone has any questions, please do put them in the chat box below, and Dr. Samira will go through them as best as she can, inshallah. So if anyone has any questions relating to the presentation that she's delivered, please do utilize the Zoom chat to send in your questions.
Okay, so anybody have any questions about any of the presentation, inshallah?
We've got a question over here. Someone's asked, I have a bacterial infection in stomach. Doctor said to eat every 2 hours. What should I do during Ramadan?
Okay, so if you've been advised that you need to eat every 2 hours and it's specific to your condition, then that's a decision that you then need to make of whether you should fast or you shouldn't, because eating every 2 hours, obviously, is not going to be possible if you are fasting. However, your health comes first, and as you know, you've been given the exemption of if you do have an acute or long-term condition which will be affected by fasting, you are exempt from fasting. However, I would also recommend that you consult your scholars for advice. Um, Speak to your doctor. How long has he recommended that you do this for? Is there any other kind of support that your healthcare professionals can give to you? So I would signpost you back to one of your healthcare professionals and equally to speak to your scholars as well.
Jazakallah khair. We have another question. A sister is expecting, and she's saying that she cannot handle being hungry because she feels like she's losing sanity and must eat. What can I do, as I don't think I can fast in such a situation?
Okay, so like I've already mentioned, you have that exemption which is available to you, but that is a decision that you need to make. If it is going to affect you or your unborn child, you have that exemption. Take that exemption, and if you're doing it to strive towards Allah for the sake of Allah, that will be your worship. Um, but that would be your decision then to make. You have that exemption. Otherwise, you would then have to make up your fasts post delivery.
Another question that we have regarding breastfeeding: does a mother, can she choose to fast or not? And is it according to her health or the health of the baby?
So it would be according to both. If it is going to be detrimental to you or to your baby, that's when you can take up that exemption. And again, I will say the same as what I've said to the other questions as well. You do need to consult your own healthcare professionals and equally your scholars for advice which is specific to you and your condition.
Fantastic. And then the advice for those with ulcerative colitis who are not on medication but are following a SCD style diet.
Again, it's exactly the same as what I've said before. If fasting is going to affect you, your condition or your body, you have an exemption which you are able to take. Um, and speak to your healthcare professionals because there may be support that they can give you, which is individualized to you and your condition, to give you that advice of whether you should or should not fast. Okay.
Yeah, I'm just reading through some of the other questions in the meantime. Is it possible for them to get access to slides somehow?
I can share them with you, brother.
What advice would you give to patients with diabetes who have thirst and hunger issues?
Okay, so the advice is, as I've already mentioned, if it is safe for you to fast, you can fast. Like I said, this year we'll have a lot more patients fasting than what have done in the past because it is the fasts are a lot shorter. Now is maybe the time where you can actually look at, how is fasting going to affect me? Can I maybe do some trial fasts? Um, don't burden your body more than what it can bear. So if your body cannot bear to fast, you have got that exemption which you can take. However, you might be surprised. You might try to fast and you might be okay. So you won't know until you try. Equally, if you have diabetes, make sure that you are checking your blood sugars more regularly. Make sure that you are taking your medication on time. And again, I will say make sure that you do consult your healthcare professionals as well.
What advice would you give to someone who's looking to eat healthy but with a small budget? Are there any specific things that they should prioritize getting?
Yes, so prioritize your proteins, prioritize your whole grain, your whole grain carbohydrates. Okay. And sometimes what I would recommend is actually plan your meals in advance. When I plan my meals, I feel as if I actually save more money because I'm not thinking at the last minute, actually, I need to go and buy this. I buy it from the corner shop, it's more expensive. When I'm buying things in bulk, it can actually be a lot more cheaper for me. Think about where can I get, fresh fruits, fresh vegetables at lower prices. So maybe can I go to a market? Can I buy things in bulk? Can I then actually use the same ingredients for multiple kind of meals and reduce the amount of wastage from foods as well? The Ramadan Reset Project actually also has tips in there about reducing wastage. And if we can reduce our wastage, we can make sure that there's more barakah in our food. Our food will last longer. That money that we've spent on one item may give us, 3 or 4 different meals. So try and think about that and plan from now, plan ahead. If you have got excess food, maybe you can freeze that and use that at a later date. That's reduced your wastage, but equally, you've then made that meal go further as well. So think about how you can support yourself.
Is coconut water good for electrolytes?
Everything is good in moderation. Okay. So coconut water is very good. Coconut water has certain electrolytes in there. However, I don't want you to be drinking just coconut water because nothing can beat water by itself. Okay. What I want you to do is make sure that you are hydrated. If you are having balanced meals, and you are hydrating yourself effectively, you're having your 6 to 8 glasses of water. You don't need anything which has extra electrolytes in there. And if we were talking about money saving, etc., coconut water has, especially here in the UK, can be quite expensive. So, think about how you can balance your meals without having to have that extra cost as well. So to answer your question, coconut water, yes, it is good, but you don't need to be just relying on coconut water. Water by itself can do the similar job as long as you have a balanced meal alongside that.
Can we have tea with milk and sugar right after iftar?
That's entirely up to you. However, caffeine, I would reduce the amount of caffeine that I am having, because like I've already told you, caffeine can cause dehydration. The amount, and obviously you want to reduce the amount of sugars that you're having as well. But if you want to have your tea with milk and sugar, entirely up to you. It's about what you're doing and you're doing it in moderation.
Any advice on calorie deficit to lose weight whilst fasting?
Yeah, so there's a lot of information out there about intermittent fasting, reducing the amount of calories that you're having, and it will help you to reduce your weight, but you need to balance that with how you are feeling. So if you feel that you're reducing the amount of calories by too much and it's affecting your health, then you probably need to think that you're not eating as much. Um, Equally, sometimes we think that we're doing ourselves good by eating less, but we might be eating the wrong foods. Okay, so have a think about what you're actually having within your meals. Are your meals um, one healthy? Are you making sure that you've got a lot of protein in there? Okay, is it helping you to feel full throughout your fast? And any small decreases in your calorie intake will actually help you to reduce your weight. But equally, you do need to increase the amount of physical activity that you're doing as well. So, losing your weight through intermittent fasting isn't just about reducing the amount of calories. It can also be done by having more calorie expenditure, so making sure that you're burning more calories as well. So think about it as a whole, not just about reducing your calories, but think about increasing your physical activity as well.
Any advice for patients who have ADHD and have to take medications but are unable to because they're fasting in the morning?
Okay, so again, I would advise to take this individualized advice from the ADHD consultant or the specialist that they are speaking to, because some of these ADHD medications need to be taken at the same time every single day. Okay, so the kind of conversation that I'd be having with the healthcare professional is this is the time that we are fasting, this is the time that we are breaking the fast. Can you tell me, is it possible for me to take my medication at this time and fast? Or would you recommend that I have to only take it at that time? Is there a different preparation that I can take instead? Is there any other advice that you can give to support me? Your healthcare professionals want to support you to be able to fast, okay? But you need to have these conversations with them, okay? And as I've said a couple of times now, don't burden your bodies more than what it can bear, okay? And your health does come first. You have got them exemptions which you can take.
If a patient has adrenal insufficiency and they have been fasting for years, they take their medication thrice a day. A doctor said they shouldn't fast, but they want to. So should they skip their afternoon dose or fast alternate days?
So I can't advise you on that. That's something that you need to speak to your doctor about, speak to your scholars about as well. Okay. And like I said before, at the end of the day, your medical professionals can give you the advice, your scholars can give you that advice as well, but that final decision lies with you. Okay. So I'm sorry, I can't answer that question directly. I would signpost you back to your healthcare professional.
For those that have thyroid conditions who need to take their medications in the morning, would you recommend taking that as suhoor time or iftar time instead?
So normally with thyroxine, I always advise to take that in the morning, first thing, half an hour before your food. So the advice is for you to take it in the morning. However, if you feel that that's not suiting you, if you do, then take it in the evening. Make sure that you are it's more important that you do take it, okay? So as a pharmacist, I always recommend that you take your thyroid medication in the morning, okay? But if it means that you're not taking it in the morning, just take it in the evening, take it before you go to bed, make sure you do take it.
I think the students are asking regarding the journal. Is there a way for them to access the Ramadan journal that you mentioned?
Yep. So what I will do is I will send you the link of where people can register. And once they register, they will then be able to get the whole toolkit. So it's not just the journal. There's a complete toolkit. There's also access for you to partake in challenges. There's a sense of community. What happened or where this project actually came to life from was my students. So I'm actually an assistant professor at the University of Birmingham. So I teach pharmacy. And I've been leading the Ramadan project since around 2018, and we do a lot of work within the community. We do a lot of work with healthcare professionals. And I had a lot of students on my team. And what the students said to me is that while we are away at university, we don't have that sense of community that we had when we were at home. We don't have that support from our parents to kind of help us while we're fasting. And we actually have seen that some of our friends choose not to fast during Ramadan. So I said to my students, what can we do to support these people who might not be able to fast during Ramadan. And my students' idea was actually if we have a Ramadan journal, we get Islamic societies on board, we get students, we get other people to actually form a sense of community where they can support each other and help each other to fast, inshallah, we'll have more people fasting. So that's where the project kind of started from. So my students then developed a complete toolkit. There's duas, there's adkar, there's recipes, there's there's healthy advice, there's physical activity advice. Um, there's places for you to actually make your own goals, for you to plan your Ramadan, and you can use it after Ramadan as well. So what I will do is I will share that link with you, and then you can, inshallah, share it with the community. And although it was primarily made for students, once you see this completed piece of work, it's actually applicable to everybody. Anybody can use this. It's not just applicable to students. So I will share that link with you, and then inshallah we can share it with the rest of the community.
Dr. Samira, is it possible to share that in the Zoom link now? Because I think some people might not be in some of the circles that we're in, so they might miss it if you don't send it in the chat
Yes.
now.
Yep, okay. Yep, bear with me and I can do that for you now,
Brilliant.
inshallah.
Thank you
I'll
so much.
I'll share the QR code again so people can scan this. Um
In the meantime, if anyone has any final questions that they would like to ask Dr. Samira, please do so in the Zoom chat, and the recording will be available on the YouTube channel.
Sorry, brother, it's not allowing me to do it. Are you able to scan it and just put the
I'll
link
send
in
that in,
for me, please?
yes.
I think I've got it. There we go.
Brilliant. So the link is now in the Zoom chat for those that want to access it. We'll just take a few more questions before we end the session. Do injections for inflammatory arthritis and others break the fast?
So injections for inflammatory arthritis, for example, are normally just taken once a day or sometimes even once a week. You can actually choose when you want to take that throughout the day. So I would actually advise that you take it in non-fasting hours. And any injection that doesn't have any nutritional value, majority of scholars believe that it doesn't invalidate the fast.
Thank you so much. Any tips or any advice for those that have acidity and gastric problems?
Yep, so I would advise that you don't overeat. Make sure that you don't have too many spicy foods, too many fried foods. Make sure that you have small meals, space out the amount of meals that you have. And if you know that certain things are going to trigger your indigestion or heartburn, avoid them. So, for example, I have some patients who um, tomatoes trigger acidity, as does garlic or ginger. So I advise avoid them foods. Okay. And then there's certain things that actually balance that out. So, for example, people feel that if they drink milk, that helps them. Okay. Otherwise, you can have Gaviscon, which you can buy over the counter. Um, So, there is lots of things that you can do. Make sure you have lots of fibrous foods because fiber can also help. One of the other main things that we do get is constipation. So for constipation, I always advise that you making sure that you're drinking lots and also having fiber diets as well.
If I'm on a calorie deficit, how can I not allow my hormones to become unbalanced, especially during Ramadan?
Okay, so we do also recommend that if you are on a calorie deficit, make sure that you are supplementing your diet with vitamins, with minerals. And if you are feeling that you're, feeling more fatigued, I advise that you actually increase your calorie intake again and make sure that you do go and speak to your healthcare professionals for individualized advice, especially regarding your hormones. So if you do have, for example, if you're premenopausal, you're postmenopausal, or if you equally have polycystic ovaries, for example, or you suffer from any hormonal conditions, speak to your healthcare professionals.
Okay, fantastic. I think one final question. Why do we get dizzy whilst we are fasting, even when we are not diabetic?
Okay, so dehydration can also be a cause of feeling dizzy. And equally, if you're out of routine, lack of sleep, all of these can actually affect you and affect your dizziness. So make sure that you are keeping hydrated, make sure you're drinking enough, make sure you're not over caffeinated, and make sure you're having a healthy, balanced meal. And that will, inshallah, support you to not feel dizzy.
Then we've got one few more questions, if that's okay. Can you use eye drops whilst fasting?
Yes.
And what advice would you have for patients who have OCD, especially when it comes to Istinja?
Okay, so I think that's something that I would push back for you to speak to about speak to a scholar about. Istinja isn't something that I would be able to comment on.
Fantastic. Can you give any advice on rabiprazole and its effect on the stomach?
Okay, so rabiprazole is a medication that's normally used for indigestion. It is what you call something that actually affects the amount of acidity that is coming up from your stomach. Coming out from your stomach. It helps to neutralize that acidity. I'm not sure what else you kind of want to know, but you'd use that if you have indigestion. If you do need any more specific advice about rabiprazole, I would say go and speak to your pharmacist.
I often sleep late for work and feel very sleepy during the day. Any advice for this?
So I would say, look back at the slides where I was speaking to you about sleep hygiene. Make sure that you have got protected time for sleep. Make sure you're not scrolling through your phone just before you go to sleep. Make sure you don't take lots of caffeine before you sleep. Rest as much as you possibly can. When we are fasting in Ramadan, obviously, our routine is out of sync, and that can affect tiredness as well. So make sure you have protected time to sleep and make sure you are resting your body.
How much weight loss is healthy during the month of Ramadan?
So weight loss is something that I would say is very subjective. It could be different for different people. I cannot give you a specific kind of number as to what would be healthy because what might be healthy for me may not be healthy for you. So I would advise that you speak to your healthcare professional regarding that.
Okay, I think someone's might be a repeat, so you can just skip over if you like. But the ruling on fasting whilst having ADHD and its impact on your function and concentration to the effect that you struggle to pray properly because you're forgetting steps
Again,
while fasting.
Again, I would say that you should speak to your healthcare professional and to your scholars to get some advice specific to you and your condition, inshallah.
How can we energize ourselves whilst fasting?
So I think it all comes down to planning, and it also comes down to kind of how you're going to look after your routine and how you're going to support yourself. So energize In what sense, do you mean physically energized, spiritually energized? It's really important that we remember that Ramadan isn't just about food and abstaining from food, okay? Ramadan is a time for us to think about ourselves as a whole, okay? So it's our mind, our body, and our soul, okay? So when we're talking about energize, what part of that do we need to energize, okay? And with planning, you can energize everything. So make sure that you are planning to energize your body by giving yourself the right nutrition and giving yourself the right hydration, supporting your medical conditions as you need to, looking after your body physically. That will energize you. Doing some kind of physical activity will also energize you. Mentally, or you got support to support you through all of your responsibilities? Are you making sure that you've got enough sleep? Have you got enough support? Have you got the tools that you need to support yourself? And then spiritually, to energize yourself spiritually, are you engaging in your ibadah as you want to? Okay, that will also energize you as well. So plan and plan effectively. So plan so that you succeed, not plan to fail.
Any advice for those that have persistent hypertension, so high blood pressure? As can they
Yes,
fast or
so
not?
okay, so again, that decision to fast is between you, your healthcare professional, and your scholars. I can't tell you whether, you personally should fast or not. You need to speak to your healthcare professionals to get that actual advice. But for somebody who has hypertension, make sure that you're not having something that is too high in salt. Make sure that you're having balanced meals. Make sure you're not eating too much fatty foods. Make sure you are eating a diet with more proteins, more wholesome foods, and just looking after yourself. Be sure to know what signs of high blood pressure would mean that you might need to break your fast. Equally, have a blood pressure monitor handy so you can actually check your blood pressure as and when needed.
What can we have for suhoor meal to keep ourselves full for longer?
So I think I touched on this in the presentation. So um, making sure that you're having a lot of protein, lots of whole grain foods. You can have lots of good fats, so such as avocados. Making sure that your suhoor meal is actually wholesome, balanced meal, inshallah.
Is it okay to fast whilst taking rabiprazole?
Normally, rabiprazole is taken once a day or twice a day. So if you're taking it, at suhoor time and iftar time, I don't see why that would affect your fast. But equally, it depends on what your healthcare professional has advised to you. So go back to your healthcare professional, have that conversation with them because your treatment plan may be different to somebody else's treatment plan.
Sometimes we get given antibiotics which are to be taken 3 times a day. How do you manage that whilst fasting?
So if you are given the antibiotics that are 3 times a day, Alhamdulillah, we are now in a position where, especially within the UK, our fasts are not that long. You can actually spread out your the medication that you'd have 3 times a day, majority of the time would be amoxicillin. You can actually spread that out through the times when you are not fasting. However, I would advise to think about what medical condition that you have, what infection that you have that's caused your healthcare professional to advise that you need to have antibiotics. Does that actually mean that you should or you shouldn't fast? Maybe it's not the antibiotics that will be, helping you to make that decision. Maybe the symptoms or the condition that you have. We used to have this problem when we had fasts in July, August time. And what we were doing at that time was not actually prescribing amoxicillin, not prescribing the medications that are taken 3 times a day, because there was not enough time between the doses for our patients to take amoxicillin. So at that point, as healthcare professionals, we were thinking about antibiotics that you can take just once a day or antibiotics that you can take twice a day. But when you are there with your healthcare professional, that is the time for you to have that conversation with them. Okay. So actually, I may not be well enough. and I may need antibiotics, but how can you support me to fast while I'm still taking these medications if I feel that I am able to still fast during, this period of being unwell?
Jazakallah khair. Just give it another 20 seconds if anyone has any further questions before we close off, inshallah. So if anyone does have any final questions, please do send it into the Zoom chat.
Okay, so
I think we are good to close off here. We'll take one last question. If I accidentally drink water, does that break my fast?
I I'm not an Islamic scholar, so I don't feel that I'm able to answer that question. I would pose that to somebody who has knowledge about the Islam to give you the answer to that, inshallah.
Fantastic. And for those that aren't aware already, we do have a Fiqh of Ramadan series currently running. So do please check out all of that on our social media platforms, inshallah. On that note, we would like to sincerely thank all of our attendees for taking the time to join us this evening. Alhamdulillah. And also our heartfelt gratitude goes out to our respected Dr. Samira Osman for sharing her expertise and practical guidance with clarity, professionalism, and honesty. May Allah reward her for her time and efforts, and for the organization for supporting us with this. Just as a reminder, once again, to stay updated with our upcoming classes, reminders, quizzes, special events. Please make sure you are following Ulum Academy UK on Instagram, Facebook, and YouTube. We regularly share beneficial content and announcements across our platforms. All the details have been sent into the Zoom chat, so please do have a look over there. As we are approaching Ramadan, we also encourage all of you to support our ongoing fundraising projects, various Sadaqah Jariyah projects that we are doing across the globe, for hand pumps, for masjids, for iftar, for orphans, for fidya, so on and so forth. So please do participate in that. Keep an eye out on the group chats and our WhatsApp channels, and whatever you're able to donate, please do contribute, no matter how small it is. If you would like to sponsor a full masjid or a hand pump, please message the WhatsApp admin, and we will be more than happy to facilitate that for you. May Allah accept it from all of us, grant us a healthy and blessed Ramadan, and allow us to benefit from what we have learned, and reward all of you and accept all of our ibadah. Until the next time, take care of yourselves, and we'll see you again once again. Assalamu alaikum wa rahmatullahi wa barakatuh.